The changes in the diet start immediately. The day after the surgery, if not the evening of the operation, individuals are started on a low carbohydrate liquid diet. Um, and once we see that the patient has done okay with that for a couple of meals, we'll give them some pureed food, which they will be on for about a week and a half to 2 weeks after surgery. And then we advance them to some soft foods, and then a month after that to regular food. The weight loss itself also starts pretty quickly. One of the things that we strongly encourage with our patients is to really be up and moving as quickly as possible after surgery. We want people to be up and walking in the hallways in the hospital the night that they've had their operation. And certainly the next day after surgery, we want them to be in the hallways walking at least 3 times a day. When they're at home, they shouldn't be staying in bed. They should be walking around the house, sitting instead of lying down, standing instead of sitting, and walking instead of standing. The rate of weight loss varies from individual to individual and depends on how much weight the person has to lose to begin with. But on average, with the vertical sleeve gastrectomy, at about a year and a half out after the operation, we would expect individuals to lose about half to maybe a little bit more than half of their excess body weight. Not their total body weight, but their excess body weight.
What other types of follow-up care are important after the procedure is done?
So follow-up with any bariatric operation is really a critical key to having a successful outcome, and that's something that we emphasize time and time again. This is not unique to the vertical sleeve gastrectomy. It's true with all of the bariatric operations. As I said, the time in the hospital is relatively short, a day to 2 days in the hospital. We see our patients for their first post-operative follow-up visit 2 weeks after that. Now keep in mind that every follow-up visit that patients have in our bariatric program, we have dietitians with us in the clinic and we have psychologists with us in the clinic, and so we see patients as a team to address the variety of issues that are best addressed by the experts in the disciplines that we have available to us. After that initial post-operative visit, 2 weeks after surgery, we see the patients a month after that, and then typically 3 months after that, then 6 months after that, and then yearly thereafter. And it's important that we continue to see patients yearly thereafter because, number one, it helps to keep patients on track, and if they do get into some bad habits or experience issues or problems, we can help to redirect them and get things heading in a positive direction. And one of the things that other programs have seen is that sometimes people don't come back for follow-up because either they feel that they're doing so well that they don't need to follow up, or perhaps they're not doing so well and they're embarrassed to come back. And we don't want either of those things to be the case, and we really want our patients to come back regularly.
Are there cases where the procedure either needs to be repeated or maybe another of the options has to be applied?
So it's an interesting question, and there are certainly instances of that. If you go back to the original description of the vertical sleeve gastrectomy, it was done as part of a staged duodenal switch. So in essence, it was done knowing for sure that there would be a second operation 9 months to a year and a half after the initial operation. And I would say that the majority of vertical sleeve gastrectomies that we have done over the last 8 years have really been as part of staged operations. It's fairly unusual to have to re-sleeve a sleeve gastrectomy, but certainly there are cases described in the literature of having to do so. We don't have any experience doing that ourselves, but that's because we tend to do a duodenal switch as the second stage rather than a re-sleeving procedure. Other programs and centers describe doing a gastric bypass as a second stage procedure, but in our experience and in our hands and with our duodenal switch results and experience, typically if you're doing a staged vertical sleeve gastrectomy planning on doing a gastric bypass, you can pretty much do a gastric bypass at the time of the original operation. And so I think that for us it makes a little bit less sense to do a staged gastric bypass with the sleeve as the first operation, but definitely with the duodenal switch, which is again the operation that we recommend to our patients in the most severe category of obesity, a body mass index of greater than 50 or 55. There are going to be instances where doing the stage approach makes a lot of sense.